you're looking for a little nip and tuck, picking the right doctor takes top priority. We will show you what to look for next. Welcome back to the Daily Buzz. 23 minutes past the hour. If you are deciding whether or not to go under the knife, you are not alone. Millions of Americans get a little nip tuck every year. But when it comes to something as serious as plastic surgery, who can you trust? Dr. Scott Greenberg is here to give us a lowdown on how to pick the perfect plastic surgeon for you. Good morning, doctor.
Morning, Andrew. How are you?
Good. Let's get started. What kind of credentials should people look for when choosing a plastic surgeon?
Well, I think the first thing is to look for certification by the American Board of Plastic Surgery.
Okay.
This is the only board that is recognized by the American Board of Medical Specialties to certify plastic surgeons in the full spectrum of plastic surgery, face, body, and breast. Second thing, membership in the American Society for Plastic Surgeons, membership in the American Society for Aesthetic Plastic Surgery, which indicates an additional interest and expertise in cosmetic surgery.
Okay, so what types of facilities are these procedures performed when you're talking about cosmetic versus plastic?
I think the key word here is accredited.
Okay.
Clearly, a hospital would be an accredited facility. There are plastic surgeons that work in freestanding ambulatory surgical facilities, and a lot of surgery is done in offices. Again, accreditation is the key, which guarantees a certain degree of standard and safety.
Okay, you mentioned plastic surgery and cosmetic surgery. I think a lot of people think they're one and the same. Is there a difference?
Well, there's certainly a difference in that cosmetic surgery is a part of plastic surgery, but when we talk about plastic surgeons and cosmetic surgeons, board-certified plastic surgeons like to differentiate between them and cosmetic surgeons in that you got to realize these terms can be used by any physician who wants to just hold up in their office and do surgery, which clearly they may not be credentialed to do, trained to do, or safe.
Okay, so can a cosmetic surgeon perform plastic surgery?
Sure, any doctor can perform plastic surgery, but they may not be a trained plastic surgeon.
Okay, so if somebody says they're a cosmetic surgeon, how is that different from being a plastic surgeon?
Well, they may not be certified by the American Board of Plastic Surgery, members of these organizations. They're not required to adhere to a strict code of ethics. They're not required to do a strict requirements for continued medical education, which includes standards in patient safety as well.
Okay, so that might be a tip-off to do a little bit more research on someone. What other recommendations do you have for someone looking for plastic surgeon?
Well, I think the first thing is clearly credentials. The second thing is to, when you call the office, to what's your comfort level with that? Did they give you information? Were they pushy? Did they allow you to ask questions and answer those? I think talk to previous patients who've been operated on by that physician. That's very important. I think when you get in with a consultation, is the surgeon willing to give you enough time to answer your questions, get all of the information that you need, both medically and financially, to make that decision? Ask, how many procedures have you performed? Finally, what types of anesthesia is in the office, and whether or not that's an MD or a nurse. These are all questions that you need to ask during the consultation to make it a safe, good experience.
All right, Dr. Greenberg, thank you so much. For more information on finding a plastic surgeon, go to our website, dailybuzz.tv.